Welcome to India TV. You're watching HealthDNA, and with us today we have Dr. Rachita Munjal, Senior Fertility Expert, Birla Fertility and IVF. She'll be talking about fertility preservation. Thank you so much, ma'am, for joining us. Welcome.
Thank you so much.
Ma'am, what is fertility preservation?
So fertility preservation is a freezing of women's eggs, basically to save her future pregnancy potential, so that these eggs can be used in future as the age advances or because of any medical condition her eggs are affected. In that case, fertility preservation strategies help. So fertility preservation can be opted by women who want to delay their pregnancies because of any reason, maybe just because they are focusing on their careers, academics, or just did not find the Mr. Right partner. So that's called social egg freezing, wherein women can, choose their life, how it has to be. They can get their liberty, freedom to live their life in their own way. As in, biological clock is not, always at their mind that I have to get married, I have to plan my pregnancy, I have to plan my baby because I'm aging. So egg freezing, social egg freezing, give a woman that liberty, that freedom to live her own life. And of course, fertility preservation can also be opted by women who are experiencing any medical disorder, any autoimmune disorder which can lead to premature ovarian insufficiency, or women who unfortunately got cancer and have to go through the cancer treatments like chemotherapy or radiotherapy, which are gonadotoxic treatments which can affect the women's eggs and reduce the potential of getting pregnant in future. And fertility preservation can also be opted by women who have family history of early menopause as well.
Ma'am, is it just an option for women? Can men also offer something like fertility freezing?
Yes, absolutely. So men can also go for sperm freezing, or sometimes in prepubertal boys, testicular tissue freezing. It helps in men who again unfortunately got diagnosed with cancer and have to go through treatments like chemotherapy or radiotherapy or any surgery, which are gonadotoxic treatments and reduce their fertility potential later in life.
Ma'am, the role of age, how crucial is age when we are opting for fertility preservation?
So for women, we all know ovarian aging, the ovarian reserve keeps on falling, keeps on reducing as the age advances, right? So we all are born with fixed number of eggs, and slowly it keeps on declining. At puberty, these eggs reach, so at birth, we are born with about 1 to 2 million eggs as per the studies. And by puberty, they reach up to 500,000, and by age 37, 38, they decrease to 25,000, and by at the time of menopause they reach up to only mere 1,000 eggs. So this is a continuous process, the decline in eggs, and not only the number, the egg quality also reduces as the age advances. So as a fertility specialist, our recommendation to every woman is, if you are planning for fertility preservation, the earlier the better it is. So the ideal age is late 20s or early 30s, I would say.
Can you just take us through the process of egg freezing?
Yes, so for egg freezing, you have to go to a fertility specialist. The fertility specialist will first do certain testings. The number one is ovarian reserve testing, which is done by your blood test called anti-Mullerian hormone, and by doing an ultrasound, we check for your antral follicle count, wherein we check or count the number of follicles in your ovaries, and otherwise general medical examination is done. After all this, basis your ovarian reserve, basis your age, a protocol is formed, what kind of protocol will be used for your egg freezing. So if we are going for egg freezing, in that case ovaries are stimulated by using gonadotropins. So basis your egg reserve, basis your age, gonadotropins are given to the women. These injections, they are injections, basically hormone injections, which are taken almost for 10 days. There is always plus minus 2 days. In between, ultrasound follicle monitoring is done to check the size of eggs, the number of follicles, and once the follicles reach adequate size, we do the egg retrieval, which comes the second step of the procedure after ovarian stimulation. So this procedure is a daycare procedure done under short anesthesia for about 15 to 20 minutes, wherein through transvaginal ultrasound guidance, a needle is put and the follicles are aspirated. So this follicular fluid is examined by the embryologist under microscope and the eggs are segregated. Then these oocytes or eggs are frozen in the lab by the process called vitrification, which is an advanced technique for egg freezing.
Ma'am, how long can we store the eggs? And are there any factors that impact the viability over the period of time?
So as per the ART law, ART Act in India 2021-22, we are allowed to store any gametes, eggs, sperms or embryos for the time period of 10 years. And if in exceptional cases, in case of couple or a woman or a man wants to extend this, we have to take a permission from the ART board. But as of now, the ART law says for 10 years we can store these eggs or sperm. And the age or the time period does not really affect the egg quality. But as I said, the earlier the better is it. So at the condition when the eggs were frozen, that will decide the ultimate outcome. So the younger age, when the eggs are frozen at younger age, they will have better outcome, better egg thaw survival rate, better pregnancy rates later. So also depend on the egg quality of the women. So at the time when they were frozen, if they were of good quality, in that case the egg survival rate will be better and the pregnancy rates will be better.
Ma'am, is fertility preservation a cost-effective option?
Yes. So if we go, a decade back, the egg freezing was a very expensive procedure where many could not afford. But now with advancing techniques coming into our country and lot of hospitals coming in, now egg freezing is very, very affordable treatment.
What are the side effects for a person who is going through fertility preservation?
So there are no major side effects for this. During the ovarian stimulation, there are minor side effects like cramping, bloating, nausea or sometimes vomiting. Sometimes because of hormonal changes, mood swings can happen, but these are only short-term effects during the ovarian stimulation period. But once the procedure is over, these effects just go, and there are no particular precautions. A woman can resume her normal activity within 7 days after the procedure.
Ma'am, how can an individual determine that fertility preservation is a suitable option for me and for the medical conditions that I have, considering that?
So fertility preservation, as I said, is a very suitable option for women who want to delay their pregnancy, of course at the right age. But I believe it's never too late. Even if some women come to us, now it's very late, but we suggest it's never too late. If you have thought of egg freezing, you should go for it. Suitable or not suitable will also depend on your age. As I said, before 36, it's the ideal time, in the early 30s or late 20s. But as the age advances, the egg quality reduces. But still, you can go for egg freezing.
If somebody is having diabetes or say some other medical condition, in that cases, do you still...
Yes, of course, we do recommend egg freezing, and diabetes or any metabolic disorder is not a contraindication for egg freezing.
Okay.
And the kind of rise we have seen in queries. So in my own practice, if I recall 3 to 4 years back, where the egg freezing queries were mere 1 to 2 per month, these queries have come to about 10 to 12 per month, which was just 1 to 2 per month in couple of years back.
What are the advancement? Do you see there has been a lot of advancement in fertility preservation? Also, do you see more trends in this thing? What are the trends that you see?
So just now we spoke about egg freezing or oocyte freezing. Which is advancement. Earlier, a decade back, or maybe 10 to 12 years back, there was more of embryo freezing. So couples, like women who is married, used to get her own egg and sperm are fertilized outside the body, and embryos were frozen. But now with the advancing techniques with freezing, like vitrification, egg freezing has very good survival rates. So women who are not married or who are single and they don't want to get embryos formed, so they can freeze their own eggs. Then also in pre-pubertal females or young childhood cancers, where unfortunately they have been diagnosed with cancers, in those women, in those girls, ovarian tissue is taken out. So it's a minimal invasive surgery, laparoscopic surgery, through which the ovary or the part of ovary is taken out from the body, sliced into pieces, and these tissues are frozen and kept in lab. And once the girl is get rid of the cancer, this tissue can be transported back into her body, into her pelvis, and it has a dual advantage. One is, of course, she can restore her fertility after months of after few months of putting the ovary back into her body, and in addition to the regaining fertility, she can also restore her normal ovarian function, the female hormone production as well. So which can, because of those hormones deficiency, sometimes there are metabolic disorders or some other diseases which can happen. So it's a dual advantage that hormone production can also be restored in such women. Then comes of course in men, sperm freezing is there. Along with that, there is a procedure called testicular tissue cryopreservation for men, again pre-pubertal men who are not able to produce ejaculate, young boys who suffer from cancer and they're not able to produce ejaculate. In those boys, we can do testicular tissue cryopreservation, although this modality is under research, experimental, but these are the advancements in fertility preservation.
Yeah, but it's a very long journey. So if you can throw some light on the emotional and psychological aspect and the kind of support that doctors provide to patients who are opting for fertility preservation.
Yes, so I would divide this into two categories basically. One is fertility preservation in people who have cancer or any medical disorder. So finding this, when a person finds that she or he has a cancer, it itself is a very devastating feeling, and but thanks to our medical facilities, the advancements, that the survival rate post cancer treatment has really improved. But yes, these cancer treatments like chemotherapy or radiotherapy are gonadotoxic and they affect the fertility. So there is, I would want to give this message that there is a life ahead of this. Once you recover from the cancer and you suddenly find out that you got rid of cancer, but now you're not able to get pregnant, or you're not able to make your partner pregnant in cases of male. So that's even more devastating after cancer treatment. So there comes the role of that fertility preservation options should be discussed when a person is diagnosed with cancer. Of course, at the time of cancer treatment, that has a lot of psychological implications, and a person is going through a lot, and maybe at that point of time fertility might not be the primary concern, but considering the life ahead of after the treatment, they should consider fertility preservation. And even after when she wants to use these eggs, when she wants to get pregnant with these frozen egg, or a man want to use these sperm after when they want to have a child, that is the time when mostly the psychological implications come in, because this is a backup plan. The best way to get pregnant, we tell, is to naturally, in cases of social egg freezing. This is a backup plan, and when these eggs are thawed, the survival is checked. Although with advancing techniques, as per the researches, the egg thaw survival rate is very good, around 90 to 98%, and the fertilization rate is also 70 to 80%. But again, it does not guarantee a pregnancy.
There's still a chance of 8%.
Yes, because eggs are combined with the sperm of the partner, embryos are formed, and then these embryos are transferred back into the woman's uterus where it has to get implanted. So with advancing techniques, yes, the fertilization rate and implantation rates have really improved, but still a lot of psychological implications play in, as in a woman or a couple or a man should not just rely on this. The best way to get pregnant is naturally, and should be, and fertility preservation, of course, will also outcome will also depend on the age when it was done.
Ma'am, if somebody is choosing a clinic, what are the points that you think one should consider while choosing a clinic?
So of course, the ethical, most important point is ethics, because now the ART law coming in, although it's a very good strategy which government has put in to regulate the sector, basically clinics and the way they are working. And of course the lab conditions, the IVF lab conditions, the procedures used for the egg freezing or the embryo freezing also plays a role. So the ethics is one thing wherein, you know, there's no misuse of any gametes. That lab should be chosen. Then of course the best of the lab infrastructure, where the state-of-art infrastructure is present in the lab, that also plays in the outcome after the fertility preservation.
Yes. What is the fertilization process then?
So when the eggs are frozen, these eggs are thawed and fertilized with the sperm, either male partner sperm or a single woman can also opt for it. Eggs and sperm are fertilized by a procedure called ICSI, which is intracytoplasmic sperm injection, or IVF procedure, wherein the fertilization is done outside the body. Egg and sperm are combined, which forms an embryo. This embryo develops by doubling, and the cell multiplication happens in the lab. And this embryo is grown in the lab for around 2 to 5 days, which a 5-day embryo is called blastocyst in medical term. These embryos are transferred back into the woman's uterus. And same is the thing if we have frozen sperm. In that case, the wife, the female partner of the man, will have to be given ovarian stimulation using injections. Her eggs are taken out and egg and sperm are combined outside the body and embryos are formed.
Ma'am, what would be your message for those who are opting for fertility preservation? What is that you would like to tell them or guide them about?
So, fertility preservation, I feel it's a boon to all the people who need it. And the earlier the better it is for women particularly, because women age faster than men, and physiologically the aging in women is associated with the reduction in number of eggs, the quality of eggs. And we particularly Indian women are, there are some studies as well wherein Indian women, we are, although it's good to, we are following westernized culture and we are very advanced these days, which is a good thing in one way, but we should not forget the fact behind, one more scientific fact, that Indian women have a tendency for earlier menopause. So there are many studies done globally where Indian women age or get menopause at an earlier age than their counterparts in the Western world. So my message to all the women over here is, in case you're planning for egg freezing due to maybe any reason, personal reason, the earlier the better it is. And some women who or men who have been diagnosed with cancer or any autoimmune disease, where the disease or its treatment can affect their fertility, so you should always think about the fertility preservation part. Discuss fertility preservation options with a fertility specialist before going for any kind of cancer treatment or chemotherapy or radiotherapy.
Thank you so much, ma'am, for giving your time. It was a pleasure talking to you.
Thank you so much.